What anatomical structure is this device related to? On this axial slice, we see a thin, high-density object within the right anterior abdominal wall muscles near the iliac crest. Coronal plane shows a similar object on the contralateral side. This was a stimulator for the ilioinguinal nerve. What is this nerve? This nerve arises from the anterior ramus of the L1 nerve root from the lumbar plexus, along with the iliohypogastric nerve. This predominantly sensory nerve passes through the superficial inguinal ring to provide cutaneous sensation to the upper medial thigh, mons pubis and labium majus in women, and to the root of the penis and anterior surface of the scrotum in men. It arises with the iliohypogastric nerve as a single trunk from the anterior ramus of the L1 nerve root. The trunk enters the abdomen behind the medial arcuate ligament and runs anterolaterally, parallel and superior to the iliac crest, traversing the anterior surface of the quadratus lumborum muscle. The common trunk is short and soon divides into the iliohypogastric and ilioinguinal nerves at the lateral edge of the psoas muscle. The ilioinguinal nerve is typically smaller and inferior to the iliohypogastric nerve, as it crosses the quadratus lumborum. This nerve also gives off some motor branches to muscle fibers of the internal oblique and transversus abdominis muscles, which are inserted into the free edge of the conjoint tendon. Here's the appearance of the ilioinguinal nerve on ultrasound. It is adjacent to the deep circumflex iliac artery and the anterior superior iliac spine. Here's an elderly male with history of bilateral inguinal hernia repair, presenting with left groin pain. This axial T1 weighted image shows prominent scarring in the left inguinal region. This case is a CT-guided ilioinguinal nerve injection. The top left axial cadaveric image shows the expected location of the percutaneous needle tip in relation to the right ilioinguinal nerve and the interspace between the right internal oblique and the transversus abdominis muscles. Coronal MR neurographic imaging shows thickening and hyperintensity of the right ilioinguinal nerve. This was in keeping with neuropathy. Bone window of axial CT shows guided needle insertion through the anterior abdominal wall between the internal oblique and transversus muscles. A post-procedure image shows the perineural injectate around the ilioinguinal nerve. Ilioinguinal neuralgia is the result of irritation, injury, or entrapment of the nerve itself during its course of traveling between the internal oblique and transverse abdominis. Surgical staples, sutures, direct penetrating or blunt trauma, or even pregnancy, likely from traction of the nerve, can contribute to the nerve injury. Commonly associated surgical procedures are inguinal hernia repair, appendectomy, and hysterectomy. Overall incidence of neuralgia is between 12 and 62%. Wow. The mechanical injury to the nerve can result in a sharp, throbbing, stabbing, aching pain without overt myelopathy or neurological deficit. Pain originates from the anterior superior iliac spine, radiating to the groin, but does not pass below the knee. Pain is exacerbated by extension of the lumbar spine, which in turn stretches the surrounding muscles and ilioinguinal nerve. Here is a thickened, hyperintense left ilioinguinal nerve as it traverses linear scarring in the left lower anterior abdominal wall. Subsequent diffusion tensor images show hypertensity along the abnormal left ilioinguinal nerve. Here again are some other images demonstrating this. Sometimes a nerve stimulator is placed. The left image shows implantation of such a stimulator. The leads were anchored to the fascia between the internal oblique and transverse abdominis. Here are scars due to a shrapnel injury and a previous herniorrhaphy at the left lower abdominal wall. We also see subtle scars of a peripheral nerve stimulator. This AP abdominal X-ray shows the electrodes within an implantable pulse generator. In terms of the surface anatomy, the yellow star notes the anterior superior iliac spine, the yellow line notes the lateral edge of the rectus abdominis muscle, and the green line shows the semilunar line. Here's corresponding ultrasound with the anterior superior iliac spine as the yellow star, the ilioinguinal and iliohypogastric nerves as the thick yellow arrows, and the percutaneous nerve stimulator lead visible, noted by the thin yellow arrows. Here's a nerve stimulator gone bad, where it's protruding from the skin. This is the x-ray of the stimulator before removal. And here is the removal of the fractured stimulator lead. You now know a lot about ilioinguinal nerve stimulators and the ilioinguinal nerve itself. Please subscribe for more awesome anatomy and radiology videos.